This vaccine came out like super quickly, dude. How do I even know I can trust this kind of vaccine? I mean, seriously, there's been a lot of stuff online. There's been a lot of news coming out. I don't know what sources to trust. Like, how do I even know to feel like this is safe for me, for my family? Like, where am I supposed to find the resources for this? There's two companies coming out that are just making this seem really complicated.
I don't understand what's going on. Why did it come out
I
so
just don't like
fast?
the idea of
I don't
this
think
thing
it
that
was
came out
tested
super quickly to my family. I don't know if I can trust it.
So I'm Lieutenant Commander Greg Wolfley. I'm the Director of Public Health at the Naval Hospital here in Guam. I have 12 years of public health experience in the Navy. So the purpose of vaccines. The purpose of the vaccine is to help us strengthen our immune system against this particular disease. And the vaccine is just a method for our body to start its own natural immunity process without being exposed to the virus itself. When you're teaching your kid to ride a bike, there are certain things you do to help protect them while they're learning to ride the bike, right? There's certain things that we implement. We'll put a bicycle helmet. Mom or dad will hang on to the seat. In the very, very simple terms that we're assisting the kid to ride that bike. The vaccine is like that. It's introducing, a protective measure so that when we come in contact with COVID-19, we already have a level of protection there.
So the vaccine is stored in very cold temperatures. The reason being is because there's a key component to that vaccine that's important that allows your body to develop its own immune response. And unless that vaccine is kept at that certain temperature, it would not be effective and we would have to discard it.
In simplest terms, I tell people it's like M&Ms. Okay, so the vaccine itself is like the chocolate center, and there's a protective coating that goes around it, but if you hold on to those M&Ms in your hand, just by having them in your hand, it starts to melt. Imagine if it didn't have that candy coating on the outside of the chocolate, it would melt even faster. And so the idea being that we keep them cool so that they don't start to melt, and that's the most simplest terms for these vaccines.
Well, not everyone has the same immune response. So those groups that are more susceptible to developing the virus must be immunized first. Otherwise, we would have a much more crucial event on our hands. So it's very important that they receive the vaccine first.
So those that are most vulnerable are considered over age of 65, and those that are on the front lines are your doctors, your nurses, and healthcare workers and your team that are facing the virus on a daily basis. It's a supply and demand issue. Ideally, everyone would receive it all at once. The problem is we don't have enough vaccine to be able to be delivered all to everyone at once. So those in society that need it the most are deemed the most vulnerable, and those that are on the front lines.
So a lot of people are concerned about this vaccine being developed quickly. If you think about it, let's talk about mom's cookbook, right? So your mom has developed her cookbook over years of experience, and she's got all sorts of recipes in there. This recipe for the vaccine was developed rather quickly, but the recipes that were before it have been happening since the 90s. And so that cookbook has been developed for several years. And it's the recipe that's new, not necessarily the entire cookbook.
Yes, it does seem like the vaccine was created very expeditiously, but actually it did go through the important stages that's required for emergency use. And people should feel rest assured that the vaccine is safe and effective. Well, I would just like to encourage everyone to get the vaccine and get it soon, not only for themselves, but for their family and for their community. It's so important that we eradicate this disease as soon as possible. The sooner you get your vaccine, the more we will have people out there that'll be safe to be around, and that we can get our society back to normal.
This is something that really is a great opportunity, and it's something that should be, because you're given that option, and you certainly have that option to choose not to, and that empowers you, don't use that as an excuse to not take advantage of a great opportunity.
Why people have done it. They've done it to help strengthen their own immune system, so that when they interact with their family members who are older in age or have compromised immune systems, that they're doing it to help protect them. I've heard members say that they're doing it so that they can maintain mission readiness, right? That we signed on the dotted line to serve in the military, and that they want to be able to maintain that. There's all sorts of reasons people have come and received the vaccine. I think it's important that if you have concerns, that you reach out to someone that you trust, reach out to someone that you know has received the vaccine, and have a conversation with them about what this vaccine will do, why we're doing it, what are the side effects, and they can share their story or their experience with them, and it's somebody that they trust, it's somebody that they know. I only know what my personal experience has been and my personal reasons about why I received the vaccine, and I think that's the important part for people.